Welcome to the fifth unit of fifth section of human physiology paper. In this section, we are going to see about sex hormones and menstrual cycle. When we talk about sex hormones, the two important hormones comes to our mind. The two hormones are estrogens and androgens. When we say an androgens, it is going to be like the predominant and functional component of androgen is considered to be as a testosterone. When we say about estrogen, we will have three different hormones like 17-beta estradiol and estrone and estriol. They comes in the category of C18 steroid category that do not have an angular methyl group attached to the 10th position, or it has a keto configuration in the A ring. They are secreted primarily by granulosa cells of the ovarian follicles, corpus luteum and placenta, that is estrogens. Their biosynthesis depends on the enzymes aromatase, which converts testosterone to estradiol and androstenedione to estrone. The later reaction also occurs in fat, liver, muscle and the brain. Fat tissues, that's what here it is mentioned. Fat means it's a fat tissue. The theca interna cells have many LH receptors, and LH act via cyclic AMP to increase the conversion of cholesterol to androstenedione. Then granular cells have many FSH receptor, and FSH facilitates the secretion of estradiol by acting via cyclic AMP. That is a secondary messenger to increase the aromatase activity. So in the case of female, you have more amount of estrogen productions. In the case of male, there is no formation of estrogen. But in the case of female, you will see the presence of both testosterone and estrogen. Whereas in the case of male, you will see only the testosterone. It is not converted into estrol or estradiol or estrone because we are lacking the enzyme aromatase. That is the main reason why in male, testosterone is not converted into estradiol or estradiol because we are lacking this particular enzyme. If we have this enzyme, then almost the testosterone is converted into estradiol. Whereas in the female, similarly, most of the testosterone formed are converted into estradiol, estriol and estrogen. So if female possesses more amount of this testosterone, then they will have male characteristics. That is what the reason why few females having beard and having mustache and all. This is all because of the testosterone levels. Okay, so the estrogen is going to be synthesized as we saw in the earlier section. That is the third section of the fifth unit of steroid hormones. So these steps are common. That is how cholesterol is converted into pregnenolone, 17-alpha-hydroxypregnenolone, D-hydroxy-epiandrosterone. Then it is converted into androstenedione. Like this we saw in that steroid hormone itself. So after the formation of this androstenedione, it is converted into testosterone. Once testosterone is formed, it is converted into 17-beta estradiol. Okay, then this 17-beta estradiol is again converted into estradiol by having one more hydroxyl group at this position. Or this androstenedione directly converted into aromatase enzyme to form a estrone. This aromatase is an enzyme which converts this ring as an aromatic ring. 3 double bonds are present in this ring. That is what the difference between testosterone and estrogen. Okay. So what is the function of this estrogen? So the estrogen is responsible for the female sexual characteristics. Female genitalia formation. That is the formation of the uterine tubes. Then they are also plays a role in cyclic changes in endometrium, cervix, vagina. These are all the things are achieved with the help of these estrogens. They increase uterine blood flow and have important effects on the smooth muscles of the uterus. Chronic treatment with estrogen causes, at the same time you can't have more amount of this estrogen. If you have more amount of this estrogen, that condition can lead to like hypertrophy. When estrogen therapy is discontinued, when you stop giving estrogen during this hormonal therapy, then it will cause withdrawal bleeding. Prolonged exposure to estrogen alone has been indicated as a risk factor in the development of endometrial cancer. So if you have more amount of this estrogen in our body, it may lead to cancer. That's also a negative effect of this estrogen. So positive effect is the development of female genitalia. Female sex organs are developed into a reproductive state after the production of this estrogen. And then this estrogen is also has immense role effect on the endocrine system. For example, estrogen decreases FSH secretions and they inhibit LH secretions. In some time, it increases LH secretion. That is known as the positive feedback. When it inhibits LH secretion, it is called as a negative feedback. The estrogen causes increased secretion of angiotensinogen and thyroid binding globulin. So they will have an effect on other hormones also, like thyroid. They exert an important protein anabolic effect in chickens and cattle, possibly by stimulating the secretion of androgens from the adrenal, and estrogen treatment has been used commercially to increase the weight of domestic animals. So here one should understand that females are nowadays they are attending the age puberty very early. Even in the 5th standard or the 6th standard students, they started having a menstrual cycle. This is because of this reason. What is that reason? For developing chickens and cattle, peoples are using commercially they are injecting estrogen to the chickens and cattle to increase their muscle mass, to increase their size, increase their weight. So that estrogens, they are again usually heat stable compound. So even when you are cooking it won't get damaged that much. So when you take this type of meat through diet, so the estrogen reaches your body. So when estrogen reaches your body, it will plays like a hormonal function. So that's why the females are growing very fast now, and they are also attaining their aging. That is menstrual cycle. Appearance of menstrual cycle is found to be very early. This is all because of this particular estrogen, which are wrongly used by the chickens and cattle growers. Okay. Then other action of this estrogen is going to be a salt water maintenance. Estrogen causes some degree of salt and water retention, but it is not going to function as aldosterone. It will have but slight impact on this particular water and salt retention. Then it also has a effect on central nervous system. So the stress behavior in animals, they increase libido in humans. That is what the attraction, positive, how the two different poles will attract each other. Like that, the female and male will have attraction. So this attraction nature is because produced by the stimulation in the nervous system by this estrogen hormone. Then it is also responsible for the development of breast in the case of females. So the development of breast occurs during the puberty time. So that development of the breast is also achieved by the action of this particular hormone. They are responsible for the pigmentation of the aerosol, although the pigmentation usually becomes more intense during the first pregnancy than it does at puberty. So this pigmentation of the breast edges is all possible because of this estrogen. Similarly, the secondary sexual characteristics, enlargement of breast, uterus and vagina, so increasing in its size, is all because of this particular estrogen. So this is why this hormone is called as a feminizing hormone. Okay, so this is what the role of this particular estrogen. Women have narrow shoulders and broad hips, thigh that converge and arms that diverge. So they are usually called as a carrying angle, wide carrying angle. So these angles, the structure of women, the anatomy of the women is all caused by the action of this particular female sex hormone estrogens. So this estrogen is usually produced from the cholesterol. In the theca interna cells, estrogen is formed and then it is converted into estradiol and it's sent to circulation. Similarly, when this androstenedione goes to granulosa cell, there also it is converted into estrone and then it is converted into estradiol and it reaches the antrum region. So this is how the synthesis of this particular estrogen occurs. The production of these androgens and estrogens are tightly regulated by these three important hormones: gonadotropin releasing hormone, luteinizing hormone, follicular stimulating hormone. So once you have more amount of this estrogen, they have negative feedback on these hormones. So when GnRH induces anterior pituitary produce more amount of LH and FSH, LH and FSH increases the production of this estrogen. Once you have more amount of this estrogen, the estrogen can inhibit the production of this LH and FSH. Similarly, GnRH, that is known as the negative feedback inhibition. So this is how the production of this hormone is controlled. The next sex hormone is the testosterone. It is known as the male sex hormone. It is a C19 steroid with the hydroxyl group in the 17th position. It is also synthesized from cholesterol in the Leydig cells. It is also formed from androstenedione secreted by the adrenal cortex. The biosynthetic pathways in all endocrine glands that form steroid hormones are similar, the organs differing only in the enzyme system they contain. In the Leydig cells, the 11 and 21 hydroxyl is found in the adrenal cortex are absent, but 17 alpha hydroxylase is present. Okay, so in the Leydig cells, the 11 and 21 hydroxylase, which are usually present in the adrenal cortex, are absent here. Instead of that, it has 17 alpha hydroxylase is present. So that why not all the steroid hormones are converted into testosterone. Only in few organs it is converted into testosterone. In few organs it is not converted, because the change is because of the presence of different enzymes and different hormones. So since the enzymes are absent, that particular hormone is not produced. If that particular enzyme is present, that particular hormone is synthesized. That is how the testosterone is synthesized in the Leydig cells, because they have the enzymes responsible for the synthesis of this testosterone. Dehydroepiandrosterone and androstenedione are then converted into testosterone. The secretion of testosterone is under control of LH, that is luteinizing hormone, and the mechanism by which the LH stimulates Leydig cells involved increased formation of cyclic adenosine monophosphate via the G protein coupled LH receptors and GS. Cyclic AMP increased the formation of cholesterol from cholesterol esters and the conversion of cholesterol to pregnenolone via the activation of protein kinase. So this is the structure of the sperm. So all these testosterone, the main role of this testosterone is going to synthesize, produce, form the sperm. This is the sperm which is going to be the representative of the male. So this is the sperm is going to fertilize the female egg, ovum. Okay, then only it's become a fertilized egg. Then the fertilized egg is going to develop into a child. So this sperm is going to have different parts, like a head part, middle piece, principal piece, and end piece. So this the principal and this end piece is going to play a vital role for the movement of this particular sperm. The energy for the movement of the sperm is produced by these mitochondria, which are usually present in the middle piece. It's like a neck region. And then acrosome is the region which is going to play a vital role to transfer or to fertilize the egg, is all achieved by the action of this acrosome. So each part of the sperm will have their own function. So this sperm is going to be produced or synthesized by the stimulation of this particular testosterone. This is the structure of the testosterone, which is going to contain the hydroxyl group here and keto group here and one double bond here. Okay, if you have hydrogenated, if this is hydrogenated, then it will form a dihydrotestosterone, which is formed by the action of the enzyme 5-alpha reductase. Okay, so this testosterone is the functional sex hormones of a male. Similarly to estrogens, this testosterone is also regulated. Production is regulated by the LH and FSH. So mainly these Leydig cells are going to produce this particular testosterone, and they have an effect on Sertoli cells, where you will produce more amount of sperm. And then when you have more amount of this testosterone, it can negative feedback effect on anterior pituitary and hypothalamus to decrease the production of GnRH, LH and FSH. So this is how the production of testosterone is under control. Then this testosterone, like estrogens, responsible for the secondary sexual characteristics of female, this testosterone is responsible for the secondary sexual characteristics of a male. The increase in the genital size and variation in the hair distribution and the body structure, these are all achieved in a male with the help of this testosterone. If you see a male is a muscle rich person, so this muscle increased size of the muscle, these are all the things are all achieved by the testosterone. The prostate and seminal vesicle enlarge and the seminal vesicle begin to secrete fructose. The sugar appears to function as the main nutritional supply for the spermatozoa. So this formation, the synthesis of sperm as well as producing the fructose, which provides energy for the movement of the sperm, these are all achieved by the stimulation of this particular testosterone. The physiological effects of testosterone are difficult to define in humans, but we studied in these type of effects in mostly experimental animals. This provoke boisterous and aggressive play. As I told earlier, the females are attracted to male and male attracts female. So these are all the things that happen by the action of these hormones like estrogens and androgens. Similarly, the hereditary baldness often fails to develop unless dihydrotestosterone is present. Anabolic effect. Androgens increases the synthesis and decrease the breakdown of protein. So it usually promotes the synthesis of protein. So it increases the growth. Which one? This particular testosterone. Secondary to their anabolic effect, androgen cause moderate sodium, potassium, water, calcium and sulfate, phosphate retentions. So these ions are all retained. It is also responsible for the increase of size of a kidney, and they are also masculinizing nature and libido in males. These are all achieved by the action of this particular testosterone. Then when the male achieved the stage of puberty, so the puberty is the term common for both boys as well as girls. So if you are saying that the appearance of menstrual cycle in female called as a puberty, then the appearance of beard, appearance of mustache are considered to be as a puberty attaining age of boys. So external genita, the penis increase in length as well as the width. Scrotum becomes pigmented and rugose. It's all stimulated by this particular testosterone. Internal genitalia, seminal vesicle enlargement, secretion of this fructose. Okay, so these are all things that happened by the action of this particular testosterone. Then change in the voice. Larynx enlarges, vocal cord increase in length and thickness, and voice becomes deeper. And the male voice is reached by the action of this particular testosterone. Then appearance of beard, pubic hair development. So these are all again achieved by this testosterone hormone. The male become more aggressive and active. Okay, then they are going to show interest in opposite sex. It's all developed by the stimulation of this hormone. The change of shoulders, muscles increase. Similarly, the production of sebaceous gland secretions. So the formation of acne in the face. These are all because of the stimulation of this particular testosterone hormone. Now we are moving to the next phase of our section, that is menstrual cycle. So this menstrual cycle is mostly for indicating a female. Okay, so whenever we talk about menstrual cycle, we should know about the female sexual organs. We should know about the structure of the female sex hormones. Then only we can know about this menstrual cycle. You can see this is particularly the vagina. Then vagina goes and ends at the region of uterus. This is the uterus. And then in the uterus we'll have two wings like structure on both left and right hand side. They are known as the uterine tube. And this uterine tube ends at ovaries. The ovaries also gets attached to the uterus. But the ovum released from the ovary will go to this particular interior part of this uterus only through this fallopian tube. So this is the direct view, and this is the side view of this reproductive system. Again, you can see here the vagina path, and then it ends in uterus, and you can see this uterus is connected to the ovary, and then it also have a uterine tube, which is also otherwise known as a fallopian tube. Okay, so in the female sexual organ vagina, we'll have a urethra in the initial region. Then the deeper region only you have a vagina, which is going to end at the uterus. Okay, so the structure of this vagina, uterus and ovary, these are all the components, fallopian tubes. They are going to play a vital role in this menstrual cycle. Whenever you talk about menstrual cycle, the menstrual cycle is of two phases. So what is menstruation? It is nothing but the release of unfertilized egg during every 28 days. If it is not fertilized, if the egg in a woman is not fertilized, then the unfertilized egg is actually released. And also there is a damage to the uterus wall occurs. Shredding of the uterus wall occurs for every 28 days. And that process is known as the menstruation. The events which are occurs during this process is known as the menstrual cycle. So a menstrual cycle is going to have two different phases. One is known as the ovarian cycle. Another one is known as the uterine cycle. So the event occurs in ovary is known as ovarian cyclic event. The event occurs in the uterine wall, that is known as the uterine cycle. When you see about this ovarian cycle, the changes which is going to occur in the ovary. So this is what you can consider as an ovary. And then each ovary is going to contain a primordial follicles. These are the follicles which are going to later develop into a ovum. So whenever a female child born, the child will have a number of primordial follicles in their ovaries. So that is the number which later become a ovum in their lifetime. So the number of ovum released by a woman is decided by the child during the birth itself. So one of such primordial follicle develops for every month. When this primordial follicle develops, it may be converted into an antral follicle. You can see the change of this primordial follicle into a antral follicle. And this antral follicle is again converted into a mature follicle. When it's converted into a mature follicle, you can see the development of different type of cells. Theca externa, theca interna, granulosa and follicular fluid. These are the cells which are going to produce the hormones, estrogens. And these hormones are going to play a role in the development of this particular ovum. So in a mature follicle, the ovum is going to be developed. Once this mature follicle is formed, the ovum is developed, then the ovum is released from this particular mature follicle. The release of this ovum from this mature follicle is known as the ovulation. Once the ovulation occurs, then this particular mature follicle, which after the release of this ovum, it gets converted into a corpus luteum. This is what converted into a corpus luteum. Before this corpus luteum, it's known as the corpus hemorrhagicum, then young corpus luteum, then it's become a mature corpus luteum. Then once this mature corpus luteum is going to be formed, then it gets decreased in its size and it gets degraded. The degraded status of this corpus luteum is known as the regressing corpus luteum. You can see that intestinal cell mass, then it gets diffused, and then it is also developed into a corpus albicans stage. So it's become disappeared in the ovary. Okay, so these changes are collectively called as the ovarian cycle. Okay, so once the egg is released, ovum is released, this ovum is taken up by the fallopian tube or it goes to uterine, and then it's settled in once if it is fertilized, during this transport of this ovum to the uterine, it gets settled on the wall of the uterine and it's developed into a child. If it is not fertilized, it is not fit into the wall, it gets released, and during that release, the wall of the uterus is also broken down and is also released. That is known as uterine cycle. When you see this uterine cycle, you can see in another diagram. So here you can see that the number of days, whatever we saw now is a ovarian cycle, it's a follicular stage and luteal phase. That is the release of ovum. That is known as the ovulation. So up to this release of ovum, it is known as the follicular phase. Once ovum is released, then the remaining phase is known as the luteal phase. So these are the ovarian phase, what we saw already. With respect to this ovum development. When in case of uterine, you can see the wall of the uterine. So from the first day to the, say around the 13th day, the uterus wall is started developing. It increases in its size, in mass. So this increase in mass and size are all achieved by the action of the hormone estrogen, which is released from this follicle. Once the wall is reached its maximum size, at that time the ovum is released and they try to come to the uterine wall. If this ovum is attached to this uterine wall, then it is developed into a child after its fertilization. Okay, if the ovum is not attached to this wall, even during this 15 to 28 period of time, then the wall started to degrade, rupture. Then it gets damaged. It's become to the lower in size, smaller in size. This time is known as the menstrual time. Okay, so the conversion of uterine wall from the smaller size to the larger size is known as the different phase, which is known as proliferative phase. Once it becomes its normal size, it also starts producing certain hormones, and it also responds to the hormones released from this corpus luteum. They are getting ready for the implantation of the fertilized egg. That happens between 15 to 28. So here one should know that this is the suitable period, window period for fertilization. The suitable time for women to become pregnant this is the period from the say around 13th day to 28th day. So if the sperm is available for the ovum during this period, then the ovum gets fertilized and then it settles down to this uterine wall, then it will become a child in later on time period. Okay, so this is what the two different phases. So in the case of uterine wall, you have a proliferative phase and secretory phase, and then few days are considered to be as a menstrual time period. That is the period where the shredding of the wall of the uterus occurs. From the first 5 days, maximum 5 days. It usually holds good for 1 or 2 days, sometimes 3 days. Even for women, for some women it goes to 10 days. But mostly 3 to 4 days is the nominal time period for the shredding of release of blood occurs through the vagina. That is known as the menstruation time period. And this is known as the uterine phase. So a woman should not bother about this particular menstrual cycle, because this is a natural event of their lifetime. Every woman should have this particular menstrual cycle. If you are not having proper menstrual cycle, then it will lead to some problem. So you should not worry about this menstrual cycle. So during this menstrual cycle, you may lose 30 ml of blood to the maximum 80 ml of blood. You should not lose more than this particular 80 ml of blood. So if you lose more than 80 ml of blood, then you should visit doctor to get reference for the reason why we are losing more amount of blood during this particular menstruation. In a dreadful disease known as hemophilia. So in that, those persons who are affected by this disease, hemophilia, they lost their life at this puberty. Because during the puberty, once the endometrium wall is broken down, the blood loss never stopped. So they lose all their bloods through their menstruation period. Then the death will be the end point for those hemophilia patients. So, but for others, don't worry about it, because if it occurs, the loss of blood occurs only for 3 to 5 days. To the maximum, say 8 days, it will happen. So you should not worry about it. Even if your age become more than 35 or 40, then the menstrual cycle stops. That stoppage of menstrual cycle after a period of 35 years or 40 years, it is known as the menopause. Okay, so it starts from the age of puberty, say about 18 years. It stops around 40 years. Okay, so that is why we are fixing the marriage date, marriage years between this 18 to say 40. Even for the childbirth, the perfect age, the maximum limit for the normal delivery is going to be at 32 years. So every woman should think over that. You should not postpone the childbirth as well as the marriage, because the nature stops your normal delivery at the age of 32. Even the possibility for the production of the child at the age of 40. So you should remember and act along with that. So if you have any questions with respect to this particular topic, you can contact me either through mail, through sivabio@gmail.com, or through phone number 9865866168. I will answer either through mail or phone. For the preparation of this presentation, these books are referred, like Ganong's Review of Medical Physiology, Guyton Hall Textbook of Medical Physiology, Wander's Human Physiology, Color Atlas of Physiology, Fox Human Physiology, and then Introduction to Human Physiology by Sherwood. So you can also refer this book to know much about this particular topic. With these words, I will conclude the final section of 5th unit of Human Physiology paper. Thank you very much.